Good morning, everyone. Actually, now it is good afternoon. Nice to see you all. Welcome to today's IE-CHI 10th Annual Legislative Forum, COVID Impact on the Medical System, Challenges and Solutions. We want to give an enormous thanks to Molina Healthcare for their generous sponsorship, not only of this event, but of all of our IE-CHI projects and our mission in general. Thank you so much, Molina Healthcare. I'm Allison Elsner, and I'm the CEO of the San Bernardino County Medical Society. I'm also the chair of the IE-CHI, or the Inland Empire Community and Health Initiative, a coalition whose mission it is to ensure that all families and residents have access to affordable, quality, and culturally sensitive health care in the Inland Empire, which includes Riverside County and San Bernardino County. You can always find more on the IE-CHI's website at iechi.org, and please be sure to check out our IE-CHI Facebook page as well. As we get started today, I do want to welcome our IE-CHI Board and Advisory Council members, and I want to give a special thanks to the members of the IE-CHI Advisory Task Force who are responsible for planning and coordinating this annual legislative forum. So if you're online with us, give us a wave. Danielle Kilkenstein with Inland Southern California United Way, Heidi Galicia with Borrego Healthcare, Cindy Sanchez with Community Health Association for the Southern California region, Alexandra Bravo, who's also one of our board members with Molina Healthcare, Alejandro Barajas with Blue Shield of California, and Kevin Mahaney with IEHP. Thank you all for such hard work in putting this event together and all of our events every year. I also want to give a shout out to our IE-CHI consultant extraordinaire, Victoria Stephan, for all of her incredible work to pull everything together and do all these behind the scenes work that she does. Thank you, Victoria. You're such a superstar. So just a couple of quick notes. Please be so kind as to keep yourself on mute if you're not talking. And if you have questions, we are going to do some Q&A after all the presenters have spoken and after the panel so that everyone has a chance to speak. We'll go ahead and take your questions by the raise hand feature to make things more interactive, or if you're more comfortable entering your questions in chat, my colleague with SBCMS, Soteria Cobb, will read your questions aloud at the end of the panel. So feel free to just enter your questions as you think of them, and we'll get to them as soon as we finish those presentations. So now I'm very excited to introduce our keynote speaker today. Brian Cotter, RN, MBA, is the CEO of Barstow Community Hospital. He has been recognized as a transformational executive leader who has led multiple seven-figure hospital turnarounds and excelled in quality metrics and operational efficiencies by implementing lean tactics, strategic planning and execution, and leadership accountability. Mr. Cotter has led operational teams in successful CMS and California Department of Public Health surveys that include DNV accreditation, medication error reduction plan, or MERP, life safety, subacute, SNF, dietary, psych, SNF, SNF, dietary, psych, paramedic, receiving, and outpatient services. He maintains team strength through communication, honesty, and integrity, and is known for his no-compromise style in the delivery of healthcare. His career spans 32 years, where he has gone from a CNA, a certified nursing assistant, all the way to CEO, with a focus on acute, post-acute, and outpatient care. He's also a veteran of the United States Air Force for 11 years, where he served in Operation Desert Storm. Thank you, Brian. We are very fortunate to have such an expert with us today. So Brian, welcome to our 10th Annual Legislative Forum, and the floor is yours.
Thank you, Allison. That was very, very kind of you. Like most of everyone here on the healthcare side, we've been in healthcare for a long time, and it really is an understatement to say that what we've all experienced here the last 2 years is very unprecedented. And it seems to be rapidly evolving, and we're facing challenges that we probably haven't faced in our careers, or the challenges are exacerbated so much we haven't seen them to this magnitude. When you mentioned that I was in the military, I was thinking back to that time when I was a reservist at that time. And I was when we sent over for Desert Storm, and the things that we had to we had to put together, and in that crisis mode that we were in for about 6 months, really, for the build up and all of that. And, that was pretty intense, but, I kind of compare that to now, and the stress levels that we all have had as, the healthcare delivery teams, very, very, very similar. And it just doesn't seem to be, really having an end in sight. So with that, the challenges that we're facing here in Barstow are very similar to, I believe, other hospitals in San Bernardino County, Southern California, and really the rest of the country, is facing. We're getting in just overwhelmed with surges, at different times of the year, but I think there is a continuous pressure on us. And the pressures that we have, I think, have led to just a myriad of stressors on our staff, and it's challenging to find staff, and to keep the mental health of our staff. The stress that is there is causing, burnout of our staff. I talk to my staff, and I go down to the emergency department in the med surg areas, and you can see it on their faces. We ask them to do so much, and I'm personally worried that there's not much left to give from our staff. And we do everything we can to help them, to motivate them, to incentivize them, to thank them, and to show our appreciation in very tangible ways. It is caused a lot of challenges, not only on the direct caregivers, but also on our administrative and our leaders. We are facing pressures of staffing ratios. We are seeing influx in our emergency departments with cases. We have, when I say we, it's kind of collective in healthcare, where we are seeing patient holds in our emergency department, which kind of compresses our available beds to see the influx of patients seeking emergency care. So it's putting stresses not only on the nurses, the physicians, the administrative areas, and the staffing is not just nurses, it's respiratory therapy, it's the environmental services, the housekeepers. I had an opportunity last week to kind of play as an RN again. I'm still licensed, so I went down to the ER last week and helped out with the front screening, the triaging, transporting patients, moving patients around in the ED, and it was really good to see. It was very stressful, but it was good for me to have that reality check of what the patients are going through, what our staff is going through, late into the evening. So, again, I had a good reality check. From a hospital standpoint and a system standpoint, we're seeing increased costs. Really, the financial burden is becoming magnified. We have staffing costs that are there, not only for core staff to attract and retain our quality staff, but also contract labor. Contract labor is necessary, but it's not ideal. We want core staff who understand our hospitals, our policies, our procedures to give great quality care, and contract labor is needed. But we see these increasing rates of contract labor. I think pre-pandemic we were spending, on average maybe $100 or so per hour for contract labor, plus or minus. Now we are north of $200 an hour to upwards of $300 an hour for contract labor to cover and to provide safe care for our patients. And it's challenging when the government reimbursement for these the care that we have to give is just covers a small portion of that. And again, the staffing crises that we're really all in. And again, it's not just nursing, it's the other departments, like I said, respiratory therapy, radiology, laboratory, all the, especially environmental services. My hat goes off to our housekeepers because they are the front line in dealing with infection control in our hospitals. We have supply costs that are going up due to all the testing requirements that we do, not only for our staff requirements for testing, but also our visitors that are coming in and being tested as well, because it is so important that patients in our hospitals that are going through a medical crisis have a family member or loved one at their side. And so we have to work with the state requirements to allow family members to come in and be there in a crisis of one of their family members, their loved one. So that's another stress. And the information that's coming out from CDPH, and I think they're doing a wonderful job in communicating. But when these mandates come out, and they change, and we may not have all the information at the time that they come out, but when they do come out, I know for me personally, my staff come to me and say, hey, we heard about this on the news last night, or we saw this AFL, Brian, what does it mean? How do we do this? And sometimes we don't have the complete information right there. So sometimes that information is evolving as it comes out. And so we do get together, and I do appreciate Dr. Sakara in the San Bernardino County Public Health Office and our Hospital Association of Southern California with Megan Barajas and Harris Koenig and all the other healthcare leaders that are on these calls. We do have great communication with CDPH and with the EMS authority several times a week, where we can discuss these things and get more information. So the mode of communication is good to explain these things to our staff and to our patients and visitors, because what I've experienced here, and I'm sure others have as well, is that the community may not understand all the requirements that the hospitals have to go to. They assume they can just go to the hospital, get all their healthcare needs met in the emergency department. We've had an influx of testing, folks coming into our emergency room, on batches of 8, 10, or 15 that are somewhat asymptomatic just for testing. So it clogs up the emergency department even more, in addition to the holds. So it's it's a challenge. But again, I think more communication, more access for the public to get testing and to be relieved of their concerns. The more we can do, the better. We're having challenges in the post-acute. If we have discharges, we want to bring our ED holds up to the critical care floors and the med surg floors. But everyone's working hard on the skilled nursing facilities and the LTACs. But again, they're having issues with staffing as well. So, I think one of our top issues as a healthcare community we need to address is how to, not only nurses, but physicians as well. The whole medical team, the nurse, the healthcare team, we're having challenges with staffing. It's not, I don't think it's isolated to any one area, or any one area is not affected. I think we're all affected to a degree. And we have to keep in mind that one of the things I worked with Dr. Sakara on and his team, the Black Infant Health Mortality team, is that there are other conditions we're still taking care of. It's not 100% COVID. And I think in the last month, what we're seeing here, and I think other hospitals are seeing too, it's more of a mixture now. We do have, your straight pneumonias. We do have MIs. We do have strokes. We still have motor vehicle crashes that come in. We still have trauma. One of the areas that we're working on here in Barstow in the high desert that we became aware of is infant mortality, and specifically African-American infant mortality in the high desert compared to the state of California. Infant mortality all in Barstow in the high desert is twice the amount as California as a whole. okay, 10.6 per 1,000 live births compared to 4.2 in the state of California. African American, it's 18.9 infant mortality per 1,000 live births compared to 8.9 in the state of California. So in addition to the COVID, we have to work on the healthcare disparities that our disadvantaged communities are still facing. We have to do, and I know COVID has impacted all of us, but we have to, somehow maintain that resiliency and that ability to multitask and be holistic for our population health, for the communities that we serve. And in addition to that, I think it's very important that not only individual hospitals and systems have integrated care models, but I think as an industry, regionally and on a state level, that we have an integrated approach to these issues with solutions. Not only integrated among our hospital health systems, but also integrated into the regulatory agencies and other areas that are affected. I really think that we're looking at the future of healthcare is a furtherance of an integrated delivery of healthcare. And I've spoken with city leaders about the population health in Barstow, and some other folks in the community. And people, the layperson in the community thinks that the hospital does everything. No, we don't do everything. Healthcare, we all know that healthcare is so complex, but the average person, isn't aware of that. So, and I'm not sure if the folks on the other speakers on the call, I'm sure you're very well aware of how complex healthcare is, but yeah, we need to have, in my personal thought, is have a more integrated approach to what we're seeing now, with the health plans, and do what's right for the patient. I've maintained my nursing license for 30 years, and I thought of a saying about 20 years ago. I'm probably not the first person to say it, but healthcare is a business, but the business of our business is patient care. And I tell my team, if we err on the side of the patient, we will be fine, and quality outcomes will drive financial success. And we have to do the basics and the fundamentals correctly, and we have to do it in a partnership way. Again, not the silos, but we have to if we have a patient-centric approach in an integration of care, I think our population health will continue to improve. And I know I'm saying, things that have probably already been said, and I'm preaching to the choir, but I think times like this, when we get into these crises, we have to maintain our clarity and our focus on what's happening, because again, I go back to the time that in Desert Storm, and I think there was when I remember the day that things kicked off, and we were told to expect. I was in an aeromedical unit, and we were told to expect 1,000 patients a day for 6 months. That's what we had prepped for, and that's all we knew. And when the air war and the ground war kicked off, the communication and our focus, we had to maintain that. So I think in the same thing, we have to maintain our focus and clarity of our goals, taking care of COVID, but also keeping in mind that cardiac and babies and pregnant moms and folks come in. We have to do all this stuff for the population health overall in a long-term, and again, in an integrated model. And I think that's what COVID has proven to us, at least from what I see in the short 20 minutes that I had to talk. So Allison and everyone else on the call, I appreciate the request to have me on here to talk, and I'm very honored, and I hope I made sense.
Well, you made a lot of sense, and I think it's good for everyone to realize straight from the source, what the priority issues are that you're dealing with. And thank you. We really appreciate that, Brian. And actually, since we have 5 minutes really before our panel starts, why don't we see if there are any questions right now for Brian? Does anyone have a question that you would like to ask of Brian right now? You can raise your hand or enter it in the chat. I see Dr. Ken Lane has a question, and you're on mute, Dr. Lane. There.
Okay, got it. Yes, Brian, fabulous presentation. Not to be pessimistic, but let me ask the question. How optimistic are you that health plans will work together to integrate their care? Health plans are competitors, but we need them to do this.
Right. I think if health plans have the right incentives and the right alignments, I don't want to be completely altruistic. But I think if health plans are incentivized and to be fair, that maybe I have a different approach to it. I reach out to health plans and say, hey, how can I help your members? How can I help keep them out of the hospital? How can I help keep your members healthy? But health plans, it is a challenge. I'm not really,
Do you know any examples of health plans working togeter?
I do.
To make your job easier.
Sure. I think the authorization piece is one. We've been working here locally with Inland Empire Health Plan, IEHP, and they've actually been a really good partner to work with, where they're looking out for their members. And I think for the folks that are coming here, I think we still need some transparency back and forth on their members and access. And it may be a contractual issue with health plans opening up their panels. I don't know that for sure, but is there an adequate network of primary care, pediatric, and across the outpatient network for access for the health plan members? Do we have enough providers to see Medi-Cal? Do we have enough providers to see Medicare in certain locales of the county and the state? And maybe that's an issue, because I do know, at least in Barstow, we have a very underserved community, and I'm sure we're not unlike any other place in California where we have pockets of underserved, and we don't have enough adequate providers that are aligned with health plans, or the health plans have access and proactively go out to these underserved and underprivileged communities to provide the health care. Because what happens when they don't have that access in the community, they do show up in our emergency department. And that's not the ideal way to run primary care. So maybe the health plans, and I'm just throwing this out, can look at their access in some of the underprivileged, underserved communities with providers seeing their members.
Thank you for that, Brian. We have a couple more questions, but I think we'll take one more right now. And Deborah Lefkowitz, you have a question.
Thank you for taking my question. I'm a health researcher currently at UC Riverside in Riverside. I work on Inland Empire, and access to care is one of my issues. I'm actually delighted to hear that you are speaking so warmly about the issue closest to my heart, which is integration of care. But that's not my question. My question is if you have any response as someone having to deal with the current change in mandates from the CDC and also from our Governor Newsom and the California Healthcare Department about nurses going into work, nurses and other healthcare workers going into work if they're asymptomatic, and shortening of the quarantine isolation period if people have tested positive?
Yeah, and again, I'm sure we're like every other hospital. We have had that the last couple of weeks, and it's challenged because we want to do what's right, and how do you balance having licensed staff but protecting other staff and protecting the patients when someone still may be symptomatic after 5 days or 10 days. I'm very fortunate. We have a great infection control nurse here who worked all last weekend. She works more hours than anyone that I can think of, and individually works with our staff and talks with them to make sure that they are safe to come back to work, because we not only want to protect our patients, we've got to protect our staff. And I don't want to bring someone in here who is going to get worse because they're in this environment. So there is a balance of the need of licensed and compliant staff to come in, but we've got to protect our staff in the long run too, and we don't want to harm the patients. So there isn't a silver bullet or an easy answer to it. It's really on a case-by-case basis. And we're kind of fortunate in Barstow. We're not a large medical center. We have a smaller limit of staff, so it's a little bit easier for us to do that. But we really do it on a case-by-case basis, and it is hard because it's not a black and white. It's not black and white. And and we have an infection control nurse who's doing a great job of this, but it's a challenge because she's getting the symptoms, being told over the phone. And but I think she's very safe and she's very cautious. What I like is that she's cautious and conservative, and we are making do. But again, we spend a lot of money on the contract labor and to protect our patients. So I hope that was an answer for you.
Thank you. I really appreciate that response and your thoughtfulness about it, which is to say that you're not just going to take the mandate, you're going to think about how it makes sense for your site and your staff and your patients. Thank you so much for sharing that.
Yeah, you're welcome. And I think, at least from my mindset is I don't need a mandate to tell me to do, I appreciate the mandates, but what's inherent is that we protect their patients. We shouldn't have to be told to protect our, and we don't. I know we don't think that way, but I just wanted to reinforce that we protect the patients. That's our first and patients and our staff.
That's great. Thank you so much, Brian. We have a couple of other comments and questions, but I want to be respectful. Our panelists are here with us for a short time today, so I think we should move into our panel. I do want to encourage you all to take a peek at some of the comments in the chat, and thank you for the comments from Dr. Felix Nunez and from Edith Laura Trad at Covered California, and Dr. Nunez with Molina Healthcare, talking about both of your respective efforts to engage in the integration process and work with all the health plans and work with IEHP and those sorts of things. So thank you for those comments. Also, Kevin Mahaney with IEHP, I see you have a question. If we're gonna, well, let's move those to after the panel, and we'll do them all at that time. So with that, thank you all. With that, Brian, thank you. That was really an amazing presentation. Helped us understand what was going on. As we recognize Molina Healthcare today for their very generous sponsorship of our legislative forum and the ongoing support of the IHI, we're excited to welcome Abbie Totten, Plan President for Molina Healthcare. Abbie Totten is a healthcare executive with almost 20 years of experience in Medicaid and the California managed care environment. Ms. Totten has extensive experience in the Medicaid and Medi-Cal public policy and managed care operations. Most recently, before joining Molina, Ms. Totten was the medical program officer at HealthNet, where she was responsible for their $7 billion California Medicaid business. She also has worked with the California Association of Health Plans, CAHP, and Local Plans of California. Ms. Totten graduated summa cum laude from the University of Minnesota, earning a Bachelor of Arts degree in child psychology and English. She lives in Sacramento with her husband and 2 children. And today, Ms. Totten will not only be facilitating our legislative panel, but I believe, Abbie, you have some remarks you're going to share with us. So thank you for all you do and for joining us here today. And take it away.
Thank you, Allison, and I really appreciate the opportunity to be here as the newbie on screen. I've been with Molina about a year, and I've been really blessed to have the opportunity to get to know many of you, as well as my own staff in the market in more depth. I mean, I just want to, I don't know if pile on to Brian is the right word, but just really support his comments on the really deep and wide impact of COVID on the medical community. And for Molina, it has really been a time of learning and pivoting from the traditional managed care model. We've had the opportunity to not only move our workforce 100% to work from home, but have to take a real look at how we engage internally and externally to make sure we support the medical community more effectively, from opening up authorizations to working more closely on transitions of care for complex members during surge periods. We've really had to make sure that in every opportunity we put the patient first. We've been very blessed to have incredible partners. As Dr. Nunez noted, IEHP has been a long-term and incredibly important partner for us in the region, and working in lockstep with them to make sure that we support the local community. We are really excited to be here today, and we have with us a very robust panel of local experts, our legislators, from our supervisors, our senators, assembly people, as well as our congressional representatives. They ensure that this community is represented well on all levels. I am very excited to be here today and have the opportunity to introduce them. We have with us today our wonderful Congresswoman, Norma Torres, who represents our 35th Congressional District. She's worked as a state senator, assembly member, the mayor and council member for the city of Pomona. In her third term in Congress, she serves on the powerful House Appropriations and Rules Committees. She's recognized for her incredible work addressing the root cause of migration from Central America to addressing cybersecurity risks at our nation's port. She is a champion for initiatives to address the increase in murder and missing Native American women and to combat the increased risks of landslide and flooding due to fires. Congresswoman Torres immigrated to the United States from Guatemala at the age of 5 and is a long-term resident of the Inland Empire. She resides in Pomona with her husband and her 2 sons, as well as having her 3rd son, Christopher, who's an Air Force veteran, who she's very proud of. The Congresswoman has received her bachelor's degree in labor studies from the National Labor College in Silver Springs, Maryland. And we are incredibly excited to have her join us here today. I'm going to go through the rest of our panel as well to make sure we get good introductions before we kick off our questions. We're also very blessed to have with us today Senator Josh Newman, who represents the 29th Senate District. He grew up in Poughkeepsie. He's another transplant just like me. His father was a general surgeon, so he's got a long-term history in our medical community. And his father worked in the emergency room at 2 local hospitals, and his mother was mayor of his hometown. So he's got healthcare and politics right to the blood. After graduating from Yale, where he majored in history with a focus on 20th century politics and government, he served as an artillery officer in the U.S. Army. His professional experience has included work in local government, public affairs and marketing, film and television production, and internet media technology. In 2012, he founded Armed Force to Workforce to assist young military veterans in pursuing rewarding career-oriented employment following the completion of their military service. And in 2016, he won his grassroots campaign for the California State Senate, where he has successfully guided more than 20 pieces of legislation to support veteran services and mental health resources, to improve our local schools and find ways to help businesses create more jobs and protect our open spaces. He and his wife, Darcy, live in Fullerton with their young daughter and 4 weird and lovable chihuahuas. I have a dog too. I know what you mean. Thank you, Senator, for joining us today. And we also have 2 of our incredible local supervisors joining us today. Supervisor Joe Baca Jr. is here. He represents our 5th district of San Bernardino County. and was elected to office in November of 2020. He is a local boy born and raised from the city of Rialto, where he attended all of our local public schools and local colleges, receiving his AA from San Bernardino Valley College, his bachelor's from Cal State San Bernardino, as well as a master's in public administration from Cal State San Bernardino, and a second master's, because he's an overachiever, in education from Azusa Pacific University. He has a 7-year career in law enforcement and 15 years experience teaching in our local classrooms. Supervisor Baca has served on the Rialto City Council, as well as previously as the California State Assembly member. Supervisor Baca has worked diligently to increase funding for senior programs, implement after-school programs for our youth, and increase funding for police and fire departments. He and his wife, Jennifer, have been married for 18 years, have 3 amazing children and 3 lovely grandchildren. And finally, we have Supervisor Jeff Hewitt, who represents our 5th district, who was elected in 2018. He grew up in Southern California, graduated from Yucaipa High School, and earned his Bachelor's of Science in Biology at Cal State San Bernardino. While in college, Jeff started his own contracting company by building new applications for existing technology and eventually applying what he learned to pole construction, including excavation, electrical, and plumbing. In 2004, he served as the Calamasa Sitting Planning Commission, applying his private sector experience to the land development in the area. In 2010, he ran for city council and won re-election in 2014 and was elected as the city's mayor 3 consecutive 1-year terms. Supervisor Hewitt's district oversees the city of Moreno Valley, Beaumont, Banning, Calamasa, Menifee, and Paris, as well as a number of unincorporated communities. With a lifetime of balance between the public and private sector, Jeff Hewitt has the breadth and depth of knowledge required to solve this area's issues. We are so honored to have the 4 of them with us today. They are a great representation of our local community. With that, I'm going to make sure we have all of our esteemed guests on. Congresswoman Torres, have you joined us this afternoon?
Yes, she is on with us, Abbie.
Excellent. Thank you so
Hi, Abbie.
much. Just want to make sure we have everyone here. I'm going to start that. I want to start the panel with, I think, one of the issues that's nearest and dearest to all of our hearts, which is the heavy toll that the pandemic is taking on our healthcare workforce. We have seen over the last 2 years, our healthcare workforce has been continuously inundated with issues, from just consistent work, wave after wave of COVID, a lack of resources, and the stress and trauma and burnout associated with the last 2 years is really fundamentally taking its toll on how we deliver care. I'd love to hear, Congresswoman Torres, from you on what's being done at a national level to really address healthcare needs of our healthcare workforce, because without them, we know we're up a creek without a paddle. And where do you think there's the most opportunity for our local organizations to take advantage of new programs at the national level, as well as potential funding opportunities? Oh, we need to take you off mute.
There we are. Sorry, I lost my screen there for a moment. Thank you so much for the opportunity to join this wonderful panel and all of you today. You are so correct. Our healthcare workers are completely overwhelmed with what is happening through this pandemic. And I think, speaking from just personal experience, having 3 nurses in my family and my youngest son also working in healthcare. What we are asking of these medical professionals has really been a traumatic experience for them. Many of them have never faced death to the extent that they have been facing it up until now. Long hours at work. You know, my sister, she is in her 60s and still working 16-hour days because her hospital is overwhelmed. So, you know, we are doing everything that we can to try to help them. I'm proud to support so many measures, you know, that we have had in Congress to expand access to quality healthcare for all, starting with the American Rescue Plan, which included $7 billion for community healthcare centers, which are often the primary source of care for high risk and vulnerable individuals. The Inland Empire received more than $9 million from that program. And during the annual appropriation process, I also inserted language for community project funding that will help bring a mobile health clinic to Pomona through the Park Tree Community Health Center. This project will serve communities not just in Pomona, but the western part of San Bernardino County, where too often people fall through the cracks of our healthcare system. I'm also proud to support the expanded access to reproductive care, including the Women's Health Protection Act, which would guarantee every person, regardless of who they are or where they live, is free to make, you know, the best healthcare decisions for themselves and their families. The fiscal year 2022 funding bill also includes an increase of $330 million for health disparities research. We know the pandemic has taken such a heavy toll, as I stated earlier. So many of our professionals are suffering through stress, trauma, and burnout, and increased behavioral challenges. So a 2021 Washington Post Kaiser Family Foundation survey found that nearly 30% of healthcare workers actively working are considering leaving their profession altogether, as they feel that they can't do it anymore, or that they don't have the support that they need from their communities. So, you know, those are the people that we really need to focus on. And I hope that through this briefing today, we can coordinate, you know, bigger efforts that we can, you know, do together to ensure that these health professionals feel supported by all of us.
Thank you, Congresswoman. We know that, you know, there is no single solution and that there is no single body that's responsible for that fix. If we don't work together, we're never going to make the progress that we need to see to support our workforce.
Right.
Now, you know, when we think about, you know, local resources, and you talked a lot about health disparities, I'd really love to hear, you know, Supervisor Baca and Hewitt from you about local health disparities, and how do we as a community work together to prioritize equity within the healthcare system? We know that in the Medi-Cal space, we have a far lower rate of vaccination. That rate of vaccination is even lower among certain minority groups within our communities. And, you know, for my staff, I know we've got some of our team on the phone that spend weekends running COVID clinics and trying to make sure we get people into care. And it's an incredibly difficult issue to address. So from a local perspective for the Board of Supervisors, what do you see as your role to really improve outcomes and reduce the disparities within our community?
Well, that's a great question. I appreciate the opportunity to be here with ICHI on the panel. That's a great question. So one of the challenges we found for some, especially in our community in the 5th District, has been language. So language has been a big barrier. Level of comfort has been a big barrier. So one of the things we've done is we've reached out to many of our churches and faith-based groups because they are trusted leaders in the community. And they've been able to communicate the message to many of those that are uncomfortable with getting the vaccination. So that has helped. Clearly, we have a lot more work to do. Some of the things we have to do a better job is expanding local clinics. One of the things the county has done in San Bernardino, they have the McKee Center. Also, they're expanding in Fontana. It's been put on hold because of the pandemic, but expanding local services and more clinics in Fontana is another thing that we're doing. The other thing we have to do is really have to get the minority and underserved community comfortable with teledoc. Because sometimes when many people inundate the emergency rooms, that puts pressure and burden on many of the staff. The other thing we're seeing within our communities is a challenge, and it's a challenge in all the hospitals. I'm sure Brian could attest to this, but it's become a bidding war amongst many of the hospitals getting staff, support staff. So for us as a government agency at ARMC, it's been very, very difficult to try to be competitive with some of the private hospitals. So that's a challenge. But, I think really looking at, mobile clinics. I know that Congresswoman Torres talks about investing in mobile clinics, additional clinics throughout the community, really educating our community on teledoc and the opportunities to use technology to get treatment or even to get a diagnosis becomes very, very important. It's become a challenge even in our local jails, making sure that our jails, have the necessary equipment, because sometimes what happens, it pulls resources. And the last piece I'll talk about is even with the homelessness issue, it's become a challenge because many of our emergency services have been called for homeless issues. So we have to relook at how we deal with that. And the last thing I'll touch on is just really behavioral health. So what the county is looking at doing is expanding behavioral health services, because many times at our hospitals, we're having patients dropped off by law enforcement and other agencies for behavioral health. So we have to expand those services. We're looking at an expanded campus within the ARMC community. I mean, it's a big complex issue, but those are just some of the things we're trying to do to try to address some of the healthcare disparity in our communities. But thank you for the great question.
Thank you.
Yes, there's two questions here, and I want to qualify first. We're either talking about, equity and getting to those harder to reach and sections of our society that have a tougher time getting to healthcare, or are we talking about the burnout with healthcare professors? I'll take the first one first, and let me go over and start off saying that in Riverside County, at least, the most impacted have been Native Americans and Pacific Islanders as far as deaths. Their percentage, they're a small population overall, but their percentage of deaths has been far higher than the other ethnic groups. And so what happened was we had an issue there with the Morongo tribe, believe it or not, has Indian healthcare from the federal government. And they found out that San Manuel, right across the border, the county border, had made the decision to go along and go through their county. And so their elderly people were getting, vaccinations a lot quicker. And there were people that, we had a lot of elderly out at Morongo. So I went ahead and made sure that we could get ahead. We couldn't wait. And this is Congresswoman Torres, that's a whole, the Bureau of Indian Affairs and all that's a whole different thing too, but you can't wait for these things. And I was really put off by the state when the first 3 months, when the vaccines came out, there was such a demand. And not only for some of those frontline patients, but mostly for our elderly, because those were by far and away the vast majority of people that were dying. And we found out that the Inland Empire, both Riverside and San Bernardino County, were getting 80% less per capita than counties like San Diego, Santa Clara. And when I found that out, I really pushed hard. I pushed back. I didn't like the formula that they were using, and we eventually got enough. But what we did to reach those more that didn't have access, and a lot of the elderly don't know how to use these computers. They couldn't go on and wait in line for hours to try to get an appointment, stuff like that. So we went ahead and we set up mobile vaccination teams, and we go out to a lot of these planned communities. We could vaccinate a whole lot of elderly people at the same time. We had the Office of Aging calling people up specifically and, getting somebody out there to bring them in or deliver that to them. So I think that's one of the big things is, we have a lot of staff. I think both counties each have over 20,000 employees total. And when we kind of put things aside and just say, this isn't your job, this isn't our job, because we got 42 different departments and we got so many layers of government, but talking about collaborating, it's so important that we do that. And we get to those people, I know that my colleague, Supervisor Perez, really pushed for getting a lot of the farm workers out of the Coachella Valley vaccinated early, where they didn't have that access. So those are the things we're doing over here. While I'm at it, I am on the board of IEHP, and I'm glad to hear what Brian said about they work very well with the Barstow Hospital. IEHP this year has expanded into areas that have been more remote and more underserved, and we're looking forward to seeing those get the care they need. But look at a nursing shortage until when we need to start doing that now. We can get Ford to make respirators, but you can't make a nurse, in less than about 2 to 4 years. And so we're going to have to have incentives. We're going to have to open up more certified nursing schools. And because there was a shortage before this pandemic, and we have basically just, they've got PTSD. I mean, these people that have been in there, and they see people die all the time, and they're overworked and they're tired. That is the very definition of what PTSD is. It's, no disrespect to our service members and stuff, but bringing those behavioral health assets around, we take care of the homeless. We take care of a lot of these other people. We need to be able to have those accessible to our hardworking people, because we can't afford 30% loss on this.
Yeah, I appreciate that, Supervisor. Like IEHP, Molina moved into those same areas, and you're right. In some of these rural areas, there just simply are not providers, and so it's on us as health plans and community members to really come together on those innovative solutions to bring care into the community, to make sure that everyone has what they need, regardless of where they live and what income level they exist at. When we talk about expanding access to care and the opportunity to bring services in, as well as, the kind of lack of staffing in some areas and burnout. I mean, we're fundamentally losing our workforce. A lot of us have seen it. We see the articles about the Great Resignation, individuals receiving higher wages by doing, Uber and Lyft driving than they receive as a healthcare worker. The next question I'd really like to target at you, Senator Newman, which is, how, as the state is looking at the impact of COVID on our healthcare workforce, what can the state do to make sure that we as a healthcare system have sufficient protections for our workforce on the wage front? How do we make sure that our community clinics and our hospitals and our provider offices can actually hire and keep a workforce to serve our communities?
So that's a simple question. Thanks, Abbie. Thank you, first of all, for having me. It's a pleasure to be here with Congresswoman Torres and my colleagues from the boards of supervisors. And so I'm Josh Newman. I represent Senate District 29, which includes parts of 3 counties, including San Bernardino County. And I serve as the chair of something called the Senate Special Committee on Pandemic Emergency Response. So I've had an interesting year, and it's been sort of an interesting, if exhausting, vantage point to watch as the pandemic unfolds. But your question is a good one. I think we need to separate it both in the immediate, with respect to the pandemic specifically, but more generally. And I think I'll start more generally. Jeff made a good point, which is it takes years to create a healthcare worker. And it's expensive. And so one of the things that the legislature is looking at, and thankfully we're in a reasonably good fiscal posture, is really investing in workforce development and making sure that our priorities are correct and monies are allocated to do exactly what Jeff correctly recommends doing. We need to increase the pipeline of healthcare workers, qualified credential workers. And to your point, Abbie, we have to make sure that they are neither saddled with really burdensome student debt, but also that they have opportunities to enter the workforce at wage levels and with working conditions that make these satisfying careers. And I think, this is my opinion, but what we're seeing, and I think Congresswoman Torres referred to it, that very large percentage of healthcare professionals that are thinking of leaving the industry, in many cases, joined for, simply for the wage. And it's really important, and as you folks know better than most, that this is more than a job. It is, it's a calling. And part of our obligation in, setting up these systems, make sure that we find people who treat it as a calling, but that we take good care of them as they do so. Specific to the pandemic, there was some discussion, and Brian, you did a terrific job. There's this tension right now between the need to staff our, emergency rooms especially, but healthcare generally, and that's leading to burnout. And the recent decision to make the allowance for asymptomatic healthcare workers to return, a difficult decision, probably could have been much more clearly conveyed. But it's against this other very, important consideration. Brian touched on it. Is the immense cost of securing contract labor to do these things. So the first order of business in the pandemic is to get through this surge, and the best way we can do that is to really focus, as folks have mentioned, on getting vaccines to the populations that most need them, but often who are least connected to the system. And I will say we need to do more to ensure that those who are either hesitant or opposed to vaccinations, are really aggressively targeted, because what we are seeing right now, particularly in emergency rooms, is a pandemic of the unvaccinated. And so the first order of business for the next couple of months has to be to address that. There's no easy solution, but that is what I and my colleagues are doing as we work with the governor's staff on an ongoing basis.
I really, when I think about our experience as a health plan trying to get people to come in, we had a team that was specifically making outbound calls, doing all the technology scheduling, doing the follow-up, getting there, staffing the clinics. You're right. We need everybody vaccinated. We need to get to a point where people, instead of going in because they're not vaccinated, are able to address their issues at home or with a primary care doc. As we think about the next, 3, 6, 12 months, the pandemic's not going away. I mean, hopefully we will get to a stage where it's endemic and it's like the flu, and every year we kind of address those issues as they come. But what can we do to help? I mean, you've got a whole bevy of people on the phone, from health plans to physicians to community organizations. How can we help you as our local representatives to really drive home the messages that we have here today and advocate for what the Inland Empire needs to ensure that we come out of this pandemic stronger than ever? And that's really for any of you.
But if you don't mind, let me start, because it's a natural segue from my last comments. What's really clear is that, because of the polarization of politics and kind of the fragmentation of our worlds in much ways, that politicians and a whole bunch of other folks don't seem to carry a lot of weight when it comes to persuading people to do the right thing. And so what I think I've learned, it is incumbent upon doctors and other healthcare professionals who have trusted relationships with their communities, with their patients. That, more than anything at this point, is going to make a bigger difference in getting people to come toward testing, to act sort of responsibly when it comes to dealing with COVID, but especially when it comes to vaccinations.
I would agree. Thank you for mentioning that, Senator. I mean, just this panel alone, I think that we are showing that we're very much, all of us, committed to helping all of you. But as the senator stated, we're not the best messengers here. We are, even on this issue, we are really dependent on healthcare professionals to be more proactive, through even if it's just through their own social networks, to continue to encourage people to get vaccinated. Unfortunately, ordering people to do what is right for themselves and for our community has proven to be, maybe not the best message or not the best approach.
Absolutely.
This is Supervisor Baca. I echo the sentiments of my two colleagues, Senator and Congresswoman. But it is important that we have trusted leaders such as the medical profession, faith-based groups, and other local organizations continue to send that message out. I mean, I'll give you an example how effective it is. I had an opportunity to participate in a vaccination site with Molina Healthcare on a couple occasions, they were able to communicate with their members. They were communicating in English and Spanish, especially in our community and underserved communities. That was so helpful. Had they not communicated that message to their membership in English and Spanish, they would not have gotten vaccinated. So that becomes very, very important that we continue to harp that message. But, this is a pandemic. We're hoping that, the surge ends someday, but I think it's just, this is a lesson learned for us going forward. How can we be better prepared for these type of situations, but continuing to allow our trusted leaders, but also having dialogue with your policymakers such as us, like how can we do a better job to help you enhance your services? I think that becomes part of the solution too. And we got to continue that dialogue, continue the partnerships, but I think that's a great point and a great question. Thank you so much.
Thank you. We appreciate your partnership.
I'm going to sound a little bit different here than the previous three speakers on the panel. And I've been called a delusional optimist several times in my life, but
I like that one.
well, and sometimes people call that courage. I just call it delusional optimism. But regardless of how you feel on the vaccine, I don't think we'll ever get more than about 70 to 75%. In fact, I've read several articles lately that, short of forcing people, holding them down, and I don't think that this country will ever do that. And I don't think they should. But I'll tell you this, the things that we can do, and this is the good news in this. Did you know that the jump from Delta to Omicron in the Greek alphabet is 11 steps? That means that 10 other variants before the Omicron tried but failed. They just didn't catch on. The reason why Omicron is out there, because it has the ability, it's mutated. I mean, every virus, every parasite, and a virus is just a microscopic parasite. Every parasite finds and wants to spread as much as it can, but it's not up to it in its natural existence to kill off its host completely. So we're seeing that Omicron is much less, its mortality rate is far less than the previous versions. Now, this is i.e. Chi, you've got Chi, there's only 7 more steps to the Greek letter Chi. So hopefully we don't hit on that one with one that takes on, because then we might have to change the name or the acronym of this great group that put this on. But what I'm saying is that, look, at right now, whether we get herd immunity or whether we get full compliance on a vaccine that still has to be getting a lot of boosters, because remember, it's amazing that we came up with something like that in 3 months. That's absolutely amazing. And it's been a great tool for so many people. But we have to move beyond that and look at other things, like, for instance, what are we doing about APOD? The ambulance patient offloading delays, those things, as far as, working together, we've got to get hospitals and we've got to get ambulance companies and we've got to get our first responders, because this last Tuesday in my first board meeting as chair, we had our 12 county fire chiefs come in there and say, hey, we've got to do something. We've got, first responders tied up for 2 hours at the hospital there with a patient that doesn't need to have them there that much, but they can't react to a heart attack or something like that. So these are all issues working together. I think these kind of panels help get us on the same page. But those are the things that, and then getting the public, we need more tests right now, especially antigen tests. The antigen tests show that you're more contagious. Those are the ones that are so important. If for no other reason, let people know when they're sick. Remember, January traditionally is always the most deadly. The flu and other things. I mean, I know all these numbers. I check. I'm a stat person. In Riverside County, January is always the most deadly. So, you add COVID onto that and everything. We've got to let people know. We got to educate the public not to tie up that emergency room if they don't have COVID and they got the regular flu or the regular cold that's going around. So these are things I think we do have to learn to live with this. I believe it's already endemic. And, going on and trying to not only get our economy back, but we've got to get our healthcare system back. And we've got to start really, like I say, making more and more nurses and every other healthcare professional.
Yeah, the long-term ramifications of this pandemic we're going to be watching them roll out over the next several years. I know when we talk about even things like, how we address our workforce and what our workforce looks like across all industries in the future, how often, I remember pre-pandemic, I would be on the road every single week on an airplane, on the driving up and down the state, and we found that virtual panels like this and virtual meetings and the ways in which our workforce has changed. And to your point, how do we better leverage our medical system, our current workforce, and now the technologies that are being developed to help support them? And are there ways to extend our workforce by better leveraging technology, since we know we can't grow docs on trees, and that 4-year trajectory for a new RN or 2 years for a new MA, that takes time. So how can we leverage all parts of the system to make sure we are, as the expression goes, all working at the top of our scope? I want to make sure that we have sufficient time to give folks who are on the line the opportunity to ask you all some questions. So we're going to, Allison, open it up, and I believe we've got staff on the line to make sure the questions come across for you all. So folks want to go ahead and raise hands if you have questions.
Sorry, I forgot to unmute. Thank you. I was just talking to Blue Streak there. Yeah. Thank you, Abbie. That was really, you really handled that well. I didn't know how you were going to get all those questions in, and you're a master. You did it. So I would love to. Yes, we do have Soteria on the line with us, who's going to field any questions that come in through chat, and we encourage you to raise your hand too, as we mentioned earlier. But I do want to jump back. There was one question we did not get to answer, and this is from Kevin Mahaney, our former board member with IHI. And Kevin's with IHP, and he had a question for Brian, which reads, Brian, do you have a handle on the top 3 social needs of patients: housing, food, and transportation? And Kevin's asking about this in the context of funders taking part in these conditions that impact health.
Yeah, thank you. I responded to Kevin in the chat. We do have, those are things that I think we have a big need still in Barstow. We have a lot of local charities, but I don't know, in the short time that I've been here, I'm not sure of the coordination of those charities. Like I said, I'm involved in some myself, and getting to know. I go to the senior center when I can on Wednesday nights to play bingo, and I talk to them, the Kiwanis Club and other groups. And the homeless, I know there was a homeless bound, and I've had a meeting with the mayor, and I've had a meeting with the city manager to address some of these things, because again, it seems like the community seems to circle around the nucleus of the hospital. But we do need to answer Kevin's question. I don't think we're optimizing it. We do need help here in Barstow in the coordination of those charities to provide those social needs. So we need help to do better.
Thank you so much. That's great. I don't know if Gary Madden from United Way has a comment. The coordination is not the issue. It's the poor level of funding and the capacity of those charities. So I think that's what you're saying. We just need to find a way that's one element that certainly needs to be enhanced as well. We all know that charities are vying for a lot of the same dollars. So does anyone else have a comment on that particular issue about the social needs for patients? I don't want to cut anyone out if any of our other panelists had a thought on that. No. All right, is anyone, we must have some questions here.
I'm not seeing any in there. I just scrolled through it a couple times, and everything's basic. It's been answered.
Yeah, it looks like it has. There was an issue that came up from one of our attendees about the kind of defaulting to the emergency room since appointments are not available. And I assume you're talking about for your children, it sounds like. Raina, is that something you'd like to ask about?
I think, Allison, just to jump in, I will say, as a mom, trying to get my own kids in for a primary care visit and for a preventive visit is really become incredibly difficult because the health system is so inundated with COVID cases. And one of the things we're seeing across the industry is over the last 2 years, people have put off their healthcare needs until they have become much worse than if they had just gone in for a primary care visit in the first place. And I think that is one of those kind of long-term issues that are going to continue to play out. One of the things that Molina has done, we actually have a nurse practitioner program we pivoted them to telehealth, so they're able to actually do well child visits with our members through telehealth. So these are our most vulnerable kids. And so we make phone calls and get them connected to our nurse practitioners because we know that right now it's really difficult to come in. And I think those types of solutions where we may not see our PCPs able to see the same volumes for a while until, Omicron settles and we finally get back to a more normal semblance of healthcare visits.
Those are good points, good observations, Abbie, especially from your point of view where you see this going on.
If I may add, just a couple of things on that. Omicron, we know that if you are fully vaccinated, those breakthrough infections are, for the most part, mild. So I think that there is lack of information to our communities as to, if you test yourself and you have a positive test, what do I do next? And then that is really based on how you're feeling, right? If you're not too sick, then just stay home and socially distance yourselves from other family members and the community, at large. But I think, that information is really lacking in the community. It's just because you test positive, if you're fully vaccinated, you're not going to die. I mean, we can't guarantee that. But the odds are really in your favor. And I think that we need to tell that story a little bit more and provide more instructions to folks in the community about what to do. I tell you, testing, just getting a test is really difficult right now. I know that as much as I travel, I before October, I was testing, twice weekly. Every time I got on a plane, to go to Washington, I tested before I got on. Every time I came home, I tested before I got on a plane to come home. And for the last 2 months, I couldn't get a test. I had to get a friend from Pennsylvania to send me 2 tests just so I can get together with my family during Christmas. And, using our office to shake the trees of people that were holding on to tests for the worst case scenario has really proven to be a benefit to our community. We were able to, pound on some doors and say, give us those tests. We can't have equipment or testing in storage, waiting for you to need it when our community needs it right now. And for example, today we were able to put on one of those drive-through, pick up a test and fairs or community events, and it worked really great. We had people that had been infected and have not been able to get a test to get back to work. Again, I think it was Supervisor Joe Baca that mentioned, the language barrier. We have a lot of warehouse workers that, may not be efficient in English and need that information in another language to be able to have access to this. This pandemic doesn't have, a name or a religious background or an ethnic background. It really impacts all of us. So as much as you can, really, really would appreciate if you can help provide some of what to do if you have a breakthrough infection in the community.
That's wonderful. Thank you, Congresswoman. We also, I want to point to everyone's attention to the chat where Dr. Nunez from Molina Healthcare has added a link to some very valuable information that is through the CDC, but I think it's a good guide for everyone to refer to. And thank you, Dr. Nunez. And also Dr. Prashanth Kumar has some good comments here. I'm just going to read them out loud. He wants to thank everyone on the panel, of course, for your input. And he believes that distrust in the system, language and cultural barriers, social determinants, and disinformation in the community all have contributed to lower vaccination rates in the patient population, especially the people he cares for, which are with kidney disease and those requiring dialysis. He agrees with the strategies leveraging community leaders, faith-based leaders, and others to promote the message of vaccinations. He's done one-on-one with his patients with the help of an interpreter, and that's had a positive impact. So that barrier to communications and relying on the trusted, again, the physician as the trusted professional seems to be effective.
You know, Allison, here in Barstow, there's a local radio station, and I've been on the radio station a couple of times in the last few months talking about vaccination rates. And I think it's more of a Hispanic listening audience, and the radio host talks about this, and we do push, and it's free. He just asked me to be on the radio for a couple of minutes, and I'll talk as a nurse and encourage people to get vaccinated. So there is a local radio station here on the FM dial that I've been on periodically, encouraging people to be vaccinated. And I'm so glad this radio station is doing that.
That's good. That's good to hear. It can only help, when they already are listeners, and then they hear you. It reinforces the message, and they automatically trust you. I think that's great, Brian. Thank you. Supervisor Hewitt, yes.
Yes, I've got to be leaving here now. I've got to go do a groundbreaking for a brand new. We have a shortage of courthouses too, if that's a whole other thing. Our justice system has been held up completely, and also it's been a real pleasure. I thank the other panelists to be on here, and certainly Aisha and Molina, and we'll look forward to fighting this fight together, guys. Thanks a lot.
We thank you so much, Supervisor. Nice to
you,
see you and have you with us. Thank you. We have about 5 more minutes. I just want to ask everyone a really quick question, our panelists, speakers. What do you think, and not to open a whole new can of worms here, but what do you think about youth and childhood vaccinations? I know we're low in our, and Abbie, you too probably have a thought on this. I know we're really low in our rates of vaccination for children, and we have all the issues going on with schools, closing back down again and all of that. Do you have a thought? Is it kind of the same situation as far as encouraging parents to feel better about vaccinating their kids, or what do you think where's that headed?
I guess I'll start, Allison. So it's a good question, and it has implications for other systems, especially for our ability to keep the schools open. It's actually, I was surprised. I asked that question to the governor's staff last week. We do a weekly call with them about pandemic-related issues, and as they represented, the rates of vaccination for 5 to 12-year-olds are sort of on par at this point with where they were for 12 through 17-year-olds, like during the same duration after approval. But as I said, the implications are huge, and to build on Congresswoman Torres's remarks a little earlier, you can sort of think of this as 2 pandemics, right? One for the vaccinated, one for the unvaccinated. And Omicron is arguably or apparently far less severe in its impacts for vaccinated people, but it's also immensely more contagious. And that's really the problem right now, which is vaccinated people have to be very careful because of the contagion and our ability to pass the disease. But the unvaccinated are the ones who are creating the massive impacts on all of these systems. So, for children, we have this huge challenge in California around, thinking around vaccinations. We are all, if you're over 40 on this call, you've lived this long because of immunization. It's one of the great gifts to mankind in the last 100 years. And yet somehow we're making a distinction between the COVID vaccination and all of the other vaccinations that most of us take for granted. And again, we turn to you, healthcare professionals, to try and inculcate, that very basic wisdom in your patients, in your communities, because that's the answer to this. That's the answer to Abbie's point earlier of getting to, that point of endemicity, where we will have to live with COVID and we will be able to, but we have to get to a point where the infection rates aren't multiples as they are now.
Yeah, I agree with you, Senator. I think a lot of it is we've got to get parents educated about what the vaccine does and how it is very similar to things we've done year after year after year for decades. My daughter just got her booster yesterday, so I'm obviously very much pro-vaccination. But I've seen it, within their friends, and there are parents who they don't know, what the impact will be on their kids. They themselves will be vaccinated, but you got a 5-year-old and you say, you wonder what is the long-term impact of this new vaccine. And we really have to educate parents about how important vaccination is. And that you're right, this has happened again and again with different diseases over time, and the importance of starting these vaccinations young so that they aren't impacted negatively.
And I'll say, I have a 5-year-old as well, and it turns out she's fine with the shots. She hates the nose test, right? So all you have to tell her, if you get the shot, you not only don't have to get the nose test, but I will buy you a unicorn stuffed animal and a hot dog and an ice cream. And that seems to work really well.
Wow, I'd take that.
Didn't try the unicorn, but that's a pretty good one.
That's a good incentive. Yeah, good motivation. That's wonderful. Thank you. Did Supervisor Baca, did you want to add anything or?
No, I just want to concur with the senator. I have a 5 and 12-year-old. They're my 12-year-old, now that the booster shot's available to 12 to 15, she's got the booster. The 5-year-old did it, but really took my wife and I really encouraging it. It's going to be okay. It took the encouragement to really take away the fear factor of the children. I'm not sure where the state's going to be in future, but I know that for other shots, that's a requirement. I'm not sure where the state's going to go, if they have any plans sometime in the future making it a requirement. But I know in the meantime, we just have to continue to see how the 12 to 15 numbers look for the booster shot, and encourage those parents with 5 to 11 and really continue to pound that message. It can't end, and it can't end today. It's something we have to be relentless with, and we just can't let off the gas pedal when it comes to encouraging folks to continue to get vaccinated at all ages. It's just a very unfortunate time in our history. It's something that almost seems surreal, but we have to continue to do our job as community leaders, respected leaders. You as doctors, encourage your patients to continue to get vaccinated, because of what it means to not just your family, but others. And we have to be thoughtful of others in this process. It's easy to say, well, I don't want to get vaccinated. Well, maybe if you get vaccinated, you save someone else's life. So that message has to continue to be echoed throughout our communities. Thank you so much.
Thank you so much, Supervisor. Yeah, it gets into the whole discussion about social responsibility and all of that, of course, which we could go on and on about that for sure. Well, all right, I think we're going to wrap things up here. Before I jump to our final thank yous, I just want to mention something really exciting that we have going on. The IHI received a grant funding a couple of months ago, and that was from Department of Healthcare Services, DHCS, with the state of California. And it was to conduct enrollment and education activities for Medi-Cal coverage for patients in the Inland Empire. And we have very happily been able to contract with 5 wonderful community organizations, many of whose representatives are on the line with us today. We have Unidas por la Música, Community Health Action Network, CHAN, Unity Hope, El Sol Neighborhood Center, and Neighborhood Healthcare. And we want to again thank them for all the hard work they're doing behind the scenes to go out and work one by one to get people enrolled and make sure families know of the huge benefit to having healthcare coverage, which provides them as patients quality access to healthcare. But the other part of this is we needed some help because of the timing involved in receiving the grant funds, the reimbursements. We needed some help with startup funds, and IEHP very generously stepped up to the plate and provided IHI with, I guess you'd call it a loan, to provide all these startup funds for these nonprofit partners to start immediately conducting their enrollment activities. So we want to give a huge shout out to IHP for just so graciously and generously saying yes to us when we asked. And it's made the difference between the project stalling or being able to be implemented immediately and to people getting covered in our system. So thank you very much, IHP, and thanks to all of you doing, I see Damaris's with Neighborhood Healthcare email right there. We thank you for all that behind the scenes work. You guys are amazing. So, all right. Thank you everyone so much for today. Thank you, Abbie Totten with Molina Healthcare, as well as for Molina's very, very generous sponsorship of this event and what we're doing as a whole. We want to thank Brian Cotter with Barstow Community Hospital for being our keynote speaker. Fabulous insights, and you're doing the good work out there, Brian. We're standing with you. We want to thank Congresswoman Norma Torres, who had to drop off the line, but we so appreciate all she is doing in Washington, D.C. and here in our region. We certainly want to thank our friend, Senator Josh Newman, who has been with us several times on this forum and has a particular understanding of this situation. So thank you, Senator. And of course, we want to thank Supervisor Jeff Hewitt with Riverside County. He had to drop off as well. Wonderful activity in this space. And Supervisor Joe Baca Jr., thank you for your dedication and commitment to solving this and many other issues that we're experiencing. So we appreciate your solution-oriented approach, all of you. I think that's about it. I would just want to remind you all that March 1st, we do have an online health education forum. We'll be promoting that and getting you the sign-up code for that. Victoria, can you remind me, please, what the topic is for that?
We're working on an update on Medi-Cal changes. And that we think is going to be the focus of the March 1st Health Education Forum. But more information will be coming out in the next 2 weeks. So please look for that. Thank you.
Fantastic. All right, everyone. Well, thank you all for your time and your expertise and your commitment. And we appreciate you all. That was a really good meeting. And we hope we see you next time, but we'll look forward to continuing to work with you. And thanks for all of you in the audience who joined in today. Without you guys, there wouldn't be such a robust discussion. So thank you.
Thank
you,
you.
Allison.
Thank
Have a
you.
great weekend,
Okay.
everybody.
Thank
Have
you.
a great weekend,
Thank you,
y'all.
everyone.
Be
All
safe.
right.
Bye-bye.
All right, bye. See you all soon.